Uncontrolled expansion in the number of COVID patients would mean that the NHS would have even less capacity to treat heart patients and cancer patients and to deal with all our other medical needs.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.
Good afternoon. I'm very glad to be joined today, not just by Sir Patrick Vallance, but by the Chancellor Rishi Sunak, who is going to tell us more in a moment about our latest package to help this country in its battle with COVID. And I want to thank Rishi for measures that will protect people's livelihoods and protect jobs, and which will help us to deliver our overwhelming objective of getting the virus under control while keeping pupils in education and keeping the UK economy moving forward. I know that there are some people who say this economic objective is so important that we should stop all measures to control the virus and stop restrictions of any kind on our social lives and on the way we run our businesses. We can't do that because, alas, the maths is inescapable. We would face many thousands more deaths, and no, to answer one commonly posed question, we would not be able to insulate the elderly and the vulnerable, not in a society with so many multi-generational households. No country has been able to do that. And an uncontrolled expansion in the number of COVID patients would mean that the NHS would have even less capacity to treat heart patients and cancer patients and to deal with all our other medical needs. So that's why we reject that extreme laissez-faire approach. And then there are others who say, on the contrary, that we need now to lock the whole place down from John O'Groats to Land's End, turn the lights out, shut up shop, close schools and universities, and go back to the same kind of lockdown we had in March and April and May. And I have to say, I don't believe that is the right course now. Not when the psychological cost of lockdown is well known to us, the economic cost, and not when it's being suggested that we might have to perform the same sort of brutal lockdowns again and again in the months ahead. And not when there is such an obvious variation, unlike last time, between different parts of the country. So that's why we're going for a balanced approach, a middle course between the Scylla of another national lockdown and the Charybdis of an uncontrolled virus. A regional and local approach, the same approach that is now being followed by some of the countries that are most successful in their fights against the virus. And so to all those who are enduring these restrictions and who have been enduring them for so long in all parts of the country, I want to repeat my thanks for your bravery, for your patience and your public spiritedness. And I repeat, there are clear signs that our collective actions are working. Yes, the reproduction rate of the virus is above 1, but thanks to the efforts of people of all ages in following the guidance and the rules, the R is about half its natural rate. And if we follow the guidance together and follow the rules, then we can get it down. And it's precisely because these measures are burdensome that from the beginning this government has provided unprecedented support to everyone in this country, support worth £200 billion to look after jobs and livelihoods and business. And as we adjust our campaign to fight the virus, it's right that we should now produce a new package of support across the country, in addition to the specific agreements we've reached with Lancashire, Merseyside, and others. And because it's far, far better to keep business going now rather than to let those jobs go forever in a new national lockdown. We will win this fight against COVID because we can see that treatments are getting better and medicines are getting better and testing technologies are getting better. And we've shown before that we can drive the R down. And in the meantime, we need to protect jobs, protect livelihoods, and put the UK in the strongest position for an economic recovery. I'm going to hand over now to the Chancellor, Rishi Sunak.
Thank you, Prime Minister. Good afternoon. Our plan for jobs will support British people and businesses wherever they live and whatever their situation. And just as we have throughout this crisis, we will listen and respond to people's concerns as the circumstances evolve. Earlier today, I announced 3 new measures. First, I'm making our job support scheme more generous for employers who can open safely but whom are struggling with the impact of restrictions on their business. Instead of employees working at least a third of their hours to qualify for support, they will now have to work just 1 day a week. And the government will significantly increase the contribution it makes towards people's wages, with businesses paying much less, just 5% toward the cost of hours not worked. This is one of the most generous versions of a short-time work scheme in the world. It is better for business, better for jobs, and better for the economy. Second, we're doubling the value of the self-employed income support grants from 20% to 40% of average profits, meaning the maximum grant will increase to £3,750. And third, we're introducing a new grant scheme for businesses in higher alert level areas, even if they can remain open. Businesses in sectors like hospitality, leisure and accommodation will be able to apply to their local authority for cash grants of up to £2,100 per month. And these grants will be backdated to August. This means we're being more generous to businesses and places which have been in higher alert levels for longer. This is our plan, a plan for jobs, for businesses, for the regions, for our economy, for the country, a plan to support the British people. Thank you.
Thanks very much, Rishi. Patrick, can we go to you for today's slides, please?
Can I just update you on some of the numbers? So this is a slide that I showed last week. The new numbers come out tomorrow, but it's a reminder that the number of people in the UK thought to have COVID based on the Office for National Statistics survey last week was somewhere between 312,000 and 362,000 people over that period. We're expecting the new numbers tomorrow, and this will be higher, I'm sure, so that we continue to see an increase in the total number of people with the virus. Next slide, please. That's one thing, the prevalence, the number of people with the infection at any one time. The second is the incidence, the number of people with a new infection every day. And again, there are 2 numbers there which are from last week, which were the estimates, again, looking back from 2 big studies, the REACT study and the ONS study. We get the updated ONS data tomorrow. But the modelling consensus suggests that between 53 and 90,000 new infections per day may be occurring. And obviously with that number of infections, you expect to see an increase in hospitalisations as well. So the number of infections overall across the country continues to increase. Next slide, please. This shows the hospital admissions. The yellow bar indicates from a month ago, and you can see an increase in the number of patients admitted to hospital every day with COVID, which is up towards 1,000 now. And with the numbers of infections, you'd expect that to continue to increase. And it's worth remembering that the number of infections leads to hospitalisations a week or 2 later, and that in turn has the effect of increasing intensive care unit numbers, and of course, unfortunately, a number of people will die as a result of that, and that will increase a week or 2 after that. So we expect to see a delay from the number of infections through to hospitalisations, through to the very serious consequences and to death. Next slide, please. Number of patients in hospital with COVID has increased again. The yellow bar shows from a month ago, you can see the number of patients across the UK in hospital with COVID. And I just want to make a point that the Prime Minister has alluded to, which is one of the reasons that care for other conditions like cardiovascular disease and oncology, cancer care, gets affected is not the measures taken to stop COVID, it's the patients with COVID who start to occupy beds. So the more patients there are with COVID, the more the pressure on the healthcare system overall, and the more the other conditions get affected because people don't have the capacity to deal with it. So it's very important to keep the numbers of infections down if we are to reduce the number of hospitalizations. Next slide, please. This is the R value over time from May through to now. We're expecting an updated value for this tomorrow. What you can see is R was very flat over the period of the summer. It was below 1. That means the epidemic is shrinking. It shrank over the period up to August. And then as measures were released and people started to make more contacts, you can see that the R increased. And it's gone up to somewhere between 1.2 to 1.5, something like that. So it's about half of the natural R, which is around 3. So it definitely reflects the huge effort that people have made to try to adhere to the various measures that are in place. The fact that we're wearing masks, we're keeping a distance, we're washing our hands, we're doing the things that we need to do to try and reduce it has brought the R down. But this also means that the epidemic is still growing. As long as R is above 1, the epidemic continues to grow, and it will continue to grow at a reasonable rate. It's doubling perhaps every 14 to 18 days, unless the R comes below 1. So that is the aim. And I do want to just say there are some areas where we begin to see real effects of what's happening. So there's some indications that amongst young people, the rates are coming down or flattening off a bit, again, due to the huge efforts that people have made to try to adhere to these changes in behaviours that we need to have in order to get this down. And in some areas of the country, we can begin to see a little bit of flattening possibly. So the measures are having an effect, but we need to do more if the aim is to get R below 1 and to shrink this epidemic. I just want to show a couple of slides now on regional pictures. Next slide, please. This is the picture that we've shown before. On the left-hand side, the darker the purple, the higher the case numbers. What you can see is the entirety of England is now purple, so that there are cases everywhere increasing, and some areas have got very high numbers, which if R stayed at 1, those would stay at very high numbers. On the right-hand side is the speed with which growth is occurring. So where it's brown, the numbers are increasing, and the darker the brown, the greater the increase. So again, in some areas, this has slowed down a bit. The rate of growth isn't as high as it was in some areas, but overall, this is growing, continues to grow. R is above 1, and therefore we should expect to see greater numbers. Next slide, please. This is the regional breakdown in terms of hospital admissions, and in keeping with the previous slide, what you can see is that the North West, North East Yorkshire and Midlands have the highest number of people in hospital. Again, some possibility of beginning to see a decrease in the rate of increase due to the measures that people are taking. And you can see London is increasing, but at a lower level, South East, East of England, and the South West at the lowest, but still increasing. So the regional picture is different. The country is essentially in different zones depending on the speed of the increase and the overall numbers, but you can see there are increases across the country as a whole.
Thanks very, very much, Patrick. Let's go to questions from the public. Yvonne from Surrey, first of all.
The question I'd like to ask is, in the event of a national or local lockdown where specific businesses are ordered to close, what financial help will be available by the government to cover particularly the cost of wages to businesses who've not been specifically told to close, but for whom there's no or limited income because their clients or customers have been ordered to close and therefore there's no work available?
Well, thanks very much, Yvonne. I'm going to ask Rishi, obviously, to comment on that as well. But we're doing everything we can to support business throughout this crisis. There are all sorts of loans available, grants available. 25k grants have been made available. There's cuts in VAT is down to 5%, I believe. Business rates deferred, doing all sorts of things we can to support you and help you, Yvonne. But Rishi, anything you'd like to say to encourage Yvonne?
Yes. So Yvonne, there's a few things that we've already put in place and a couple more things that we announced today that I think will be of help to people in this situation. If you're told specifically to close, then your business will be eligible, the business premises will be eligible for grants of up to £3,000 a month, and that will last as long as you have been told to close. And then for your staff, the wages of those staff will be paid by the government at 2/3. All the employer has to do is just contribute to the national insurance contributions if they are owing at all. So I think that's sensible and generous treatment for people in those situations. For people who perhaps are suffering from a supply chain, as I think you're talking about, if you're involved in a supply chain where businesses that you supply are having a tough time and that's having an impact on your business, I think a good example of that is in tier 2 areas where some of the restrictions that we've got in place are having an impact on businesses, even though they haven't been told to close, but revenues are down, whether that's hospitality or otherwise. We made 2 announcements today that will help. Businesses, particularly in the hospitality sector, will be eligible for grants worth 70% of the value of the ones I mentioned earlier. So that will be up to £2,100 per month. A sum of that amount will be made available to the local authority for them to allocate at their discretion. So it may be that they choose to do something slightly different with it, but we will size the value of the grants for the number of hospitality, leisure and accommodation businesses in a particular tier 2 area. And again, those grants will be available monthly. And then secondly, for the wages of people, of the staff in those types of businesses, the newly generous job support scheme, I think, will really help. So you will be able to, rather than let go of those employees, they can work on reduced hours down to now just 1 day a week, so they have some work that they can do. And for the rest of the time, those employees will be paid 2/3 of their normal wage. The employer just needs to pay 5% of that, and the government will pick up the rest of the bill. So I think that's, again, as much support as we can provide to help keep people in work, in businesses, even though those businesses are going through a very tough time. So hopefully, as I said, those 2 things we announced today, coming on top of what we've already done, will make a real difference.
Thanks very much, Rishi, and thanks, Yvonne. Liam from Bradford asks, what can and will you do to encourage new and innovative business to emerge at this time, a critical component of economic growth which seems to have been forgotten? How can we share the risk? Well, Liam, again, I would say that the UK is one of the most competitive and dynamic environments to set up a business under any circumstances. We have all sorts of advantages, but we now have the advantage, as I said just now to Yvonne, of unprecedentedly low business rates of VAT. We have a low corporation tax, and we are, putting in fantastic investments now in a lot of the things that business will need for long-term growth. The investment in skills, in infrastructure, in gigabit broadband, where we want to be leading the world, giving start-up businesses the basic foundation on which to build. But Rishi, anything you'd like to add for Liam?
I think, Liam, you're absolutely right. We're very lucky in this country to have fabulous entrepreneurial startup companies. They will help drive our recovery, so they haven't been forgotten. I'd probably point you to one particular intervention we made earlier on in the crisis, and that was to create something called the Future Fund. You heard the Prime Minister talk about the various loan grants and guarantees that we've made available throughout the crisis. Now, they worked quite well for traditional businesses, which had cash flows and profits before. They weren't well suited to start-up businesses like the ones you're describing, who were before that, pre-revenue stage. So what the Future Fund did is it shared the risk, exactly as you mentioned, between the government and investors. And what we said is we will match the investment that private investors put into these startup companies, whether that's in a Series A round or a seed round or an angel round, anywhere from a couple of £100,000 all the way up to 5 million. And that fund has proved to be really successful. I think it's been warmly welcomed by the startup and entrepreneurial community all across the country, and it's funded just under 1,000 companies so far. And as you said, I'm hopeful that that will provide them with the financing they need to survive through the crisis, share the risk with the taxpayer, but then emerge stronger on the other side and help drive our growth and recovery.
Brilliant, thanks. Let's go to Laura Koonsberger of the BBC.
Thank you very much, Prime Minister. Firstly to you, Chancellor. The problems with the first version of your job scheme that you've rewritten today were obvious to many people in the industry from the start. Why do you keep underestimating the help that people really need? Sir Patrick, can I ask you if you agree with Scotland's Chief Medical Officer, who's told families there's no question of anything like a normal Christmas and they should plan to celebrate digitally? And Prime Minister, to you, this week you've been to war with leaders in the north of England. You're still leaving some workers on 2/3 of their wages or telling them to claim benefits. And cases of coronavirus keep on rising. Is this really the kind of leadership you think the country deserves?
Rishi.
Laura, I think it's a perfectly fair question to ask about the timing of this. I think if you think back to the summer when we designed the job support scheme in conjunction with business and business groups and unions, I think at that point we were looking forward to the economy reopening and restrictions being lifted. Now what we've seen in the especially last 4 or 5 weeks, as these new restrictions have been put in place, the impact they're having on the ground has been highly significant, particularly to businesses in the hospitality sector, particularly in these tier 2 areas. And it's the cumulative weight of all these new restrictions has really, if you speak to anyone in this industry, they're seeing it in their numbers quite significantly over the past few weeks. And that's why, as we've always said, we will adapt and evolve our response as the situation changes. Now, as the health restrictions have changed and that's had an impact on the economy, I think it's right that we respond pragmatically and flexibly to that, because ultimately what we're trying to do is protect people's jobs and income, and the measures that we've put in place today, I'm confident will do just that, and this will be now in place for a while to come, and I think is very generous and effective support.
I think the numbers speak for themselves. They're increasing, and they're not going to decrease quickly. And I think it's likely that some measures of restriction are going to need to be in place for a while to try and get those numbers down. Obviously, the quicker you get the R below 1, the quicker numbers come down, and things then give a bit of room. And so a lot depends on what happens now over the next few weeks. At the moment, the numbers are headed in the wrong direction, but as I say, there are some signs in some places of a potential flattening off of that, and we need to wait and see and monitor the numbers very, very carefully.
Well, Laura, I'm afraid, strongly reject what you say about me being at war with local leaders. That's not the case. We've had great conversations with local leaders, mayors, and others in Liverpool, in Lancashire, in Yorkshire, in the West Midlands, South Yorkshire, I should say, London, and everybody has come to the table, shown leadership, stepped up to the plate, and agreed to help bring the R down in that particular area, which is what we need to see. I'm grateful also to Andy Burnham in Greater Manchester, where he's agreed to help bring the R down with a package of measures in Tier 3. And as Patrick has just said, thanks to the efforts of people across the country, we are starting to see some progress. And it is early days yet, and it will be tough. But I really think that people do think across the country that this balanced approach, avoiding another full-scale national lockdown and avoiding letting the virus rip, is the right way forward, and that is what we are pursuing. A balanced middle course, relying on local cooperation. And Laura, I must, as I say, I disagree with you. We've had fantastic and extensive local cooperation, and yes, it's tough, but we will certainly get through it very well. Let's go to Beth Rigby of Sky News.
Thank you, Prime Minister. Is the backdated Tier 2 business support today an acknowledgement that you were not supporting parts of the north of England properly for weeks during the summer? Andy Burnham's right, isn't he, when he says that you have neglected the north? And isn't this announcement today an attempt to right that wrong? And Sir Patrick, at a SAGE meeting on May the 1st, the SAGE committee agreed that at least 80% of contacts would be needed in the test and trace system to make it effective. The test and trace scheme is contacting less than 60% now. How disappointing is that? And what are the implications of it in terms of tackling this disease?
Beth, no, the issue is really one of basic fairness as between the various parts of the country that are having to experience regional restrictions. That's what we were trying to achieve in the last 10 days. What we're doing now is bringing forward measures that are designed to help businesses that can't trade as they normally would and are experiencing a fall in income, as Rishi has said. That's what we're trying to do. We're doing it, and we're doing it across the whole country, and it's backdated, as you know, to August. But Rishi,
I think I'd just echo what you said, Prime Minister Beth. This is simply about fairness. It's about treating people the same wherever they live and whatever their situation. All the interventions that we've put in place are there on a national basis. And as different parts of the country experience different restrictions at different times, our various support measures, whether it's grants for businesses or the job support scheme, will be there to help them, their businesses, support their wages at whatever time that is. But we approach everything from a position of wanting people to have the equal support wherever they are, not just within England, but in every part of the United Kingdom as well.
Thanks very much, Beth. Let's go to Ben Kentish of LBC. Oh, sorry, Patrick, yes.
So on the test and trace, it's undoubtedly the case that test, trace and isolation becomes much more difficult to have an impact once numbers are high. So it's much more effective when numbers are low. That's the first point. The second point is that I think the testing system has ramped up the numbers they're able to do quite effectively, but it's really important to concentrate on numbers of contacts, isolation as quickly as you can, and getting things back as quickly as you can, ideally to get the whole process done within 48 hours. And it's very clear there's room for improvement on all of that, and therefore that will be diminishing the effectiveness of this. But the effectiveness anyway of test and trace is less when numbers are high than it is when numbers are low.
Thanks very much. Ben Kentish of LBC. Ben, you need to unmute, or somebody needs to unmute you.
Can you hear me now?
Yes, got you.
Thank you, Prime Minister. I wanted to follow up on that issue, actually, because countries like South Korea, Germany and Taiwan have shown that there is an alternative to the sort of restrictions that much of the UK is now under, and that is a functioning test and trace system. We're testing more people than ever, but clearly something's going wrong. For example, in June, Prime Minister, you said you wanted 100% of test results to be back within 24 hours. Today, the current figure is just 15%. So what do you think's gone wrong there? And when can you assure the British public that that system will be effective enough to start to control the virus as it has in other countries? And just very quickly for the Chancellor, unprecedented times we're in, clearly unprecedented spending is needed to support people. But with UK debt hitting 2 trillion, the highest since the 1960s, how long do you believe that can go on for, and how concerned are you about that figure?
Well, first of all, Ben, on your point about NHS test and trace, look, I share people's frustrations, and I understand totally why we do need to see faster turnaround times, and we do need to improve it. We need to make sure that people who do get a positive test self-isolate. That's the absolutely crucial if this thing is going to work in the way that it can. But I just would stress to you, Ben, that the achievements of the testing operation have been colossal. You know, they have moved from a capacity of I think 3,000, 2,000 tests per day to about 300,000 now. We've tested 26 million tests, more than any other country in Europe, and they are on track to reach a capacity of 500,000 by the end of this month. And the technology is improving the whole time. But the crucial thing to get NHS test and trace to work is that if you test positive, then you've got to self-isolate. And don't forget that there's a £500 to help you with the cost of that, but also a £10,000 fine for not doing so. The thing depends on people self-isolating and breaking the transmission. It is helping a bit already to break the transmission. About 1 million people, as I say, have been 1 million contacts have been reached. But there is more that it can do if everybody complies once they're contacted by NHS Test and Trace.
Ben, you're right to highlight the unprecedented increase in borrowing that's happening this year and the consequent rise in our debt levels to close to 100% of debt to GDP. And as you said, those are unprecedented numbers at unprecedented times. Now, whilst it is right to act, I think, with scale during a crisis like this to try and protect jobs and employment, and ultimately that will protect our economy in the long run, it's also right that because of those numbers that you highlighted, that we always have one eye on the long-term public finances, because we want to make sure that we are careful with that. It's clearly not sustainable to carry on acting in this way forever. So as we continue intervening in the economy, it's right that that is targeted and effective and done in a way that we won't always be able to do absolutely everything that everyone would like us to do. And it's because of that, because of the things that you highlighted, that will be the case, that we've got to have one eye on the long-term health of the economy and public finances and make sure that, once we get through this, we can return those public finances and the economy to a strong and sustainable position.
Thanks very much, Rishi. Let's go to Chris Smith of The Times.
Thank you. Chancellor, firstly, just picking up on your last point, given that the government strategy now is to suppress the virus until a vaccine is found, and having accepted the need for more support today and saying it will be in place for a while to come, can you guarantee that this level of help will continue to be available until a vaccine is in widespread use? And then to Prime Minister and Sir Patrick on test and trace again. Sir Patrick, you said that it's more effective when numbers are low and it's diminishing effectiveness as cases rise. So have we now missed our moment effectively for this system to work? Is it salvageable, or are cases now just increasing too quickly to keep up?
Chris, I'll let the Prime Minister and Patrick comment on the vaccine and the part that plays or doesn't in the medium-term strategy. But what we wanted to do was give businesses and employees some certainty and ability to plan through, what is clearly going to be a difficult winter period. So what we have said is that the job support scheme, which starts on November 1st when furlough finishes, will last for at least 6 months. So it will last through to the spring. There will be a review point in the middle so we can have a look at it and make sure that it's working well. But that support in its guise will be there through this difficult period through to the spring to give people that certainty. And because we know, as the Prime Minister said a while back, this is something that will be a fact of our lives for some months to come. I think more broadly, most of the economic interventions we've made also now have that predictability through to the spring, whether it's the business rates holidays or the changes we've made to some of the loan programs or the VAT cut for hospitality. Again, all of that will provide cash support to businesses and people, throughout this period. But I'll let the Prime Minister and Patrick talk about the kind of medium-term outlook. Well, I just add one obvious point, Chris, to what Rishi has just said, and that's, clearly this is what we're announcing today is billions more going into to support the UK economy, support jobs and livelihoods, and that's right. It's far better to do that and keep the economy going, because we're going to have to pay this money back, and we want to be in a position where the UK economy, where companies are kept alive, jobs are supported, people's skills are maintained, their energies are maintained, so that the UK can bounce back as strongly as possible once, as you say, we get the virus back under control. And that's the objective. And I think that if you look at the way the science is changing, and you look at the improvements in treatments, in therapies, in drugs, look at the changes we're seeing and the improvements in some changes in the mortality rates, I am confident that we will get through this very well in due course. But for the moment, and improvements in testing technologies, as I said last week, really interesting improvements in testing technologies. But for the moment, we have to use the same tools that we've got, which is the social distancing measures, all those restrictions that we put in place, and we have to do that at a local and a regional level, because that's the commonsensical thing to do.
And if we do it together in the way that we can, and we follow the guidance together in the disciplined way that we can, and by the way that people of all age groups seem to be doing across the country, then we will drive that R down again, and we will get it under control. And in the meantime, we will have supported our businesses, kept them alive, kept jobs going, and will be in a better position to come out of it. That's what we're doing. Patrick.
On vaccines, I think things are progressing well. There are vaccines that produce an immune response. They're in phase 3 clinical trials. We should be seeing some data readouts over the course of this year. But I remain of the view that the possibility of sort of wider spread use of vaccines isn't going to be until spring or so next year, by the time we get enough doses and enough understanding of the outputs to use them. Now, we may get a few doses this side of Christmas, maybe something could happen, but I think we should more realistically be looking at spring. And of course, there are no guarantees until the studies have read out. So we need to be cautious and carry on, but there is a good progress in terms of the vaccines. In terms of test and trace and the number of cases, test and trace will work effectively across parts of the UK where cases are lower. That's when it can work most effectively. It has much less of an impact at the areas where you've got very high levels, and that's why additional measures are taken, and that's why additional isolation measures, having to take difficult decisions around premises that need to be shut and so on. That's why they need to be taken, because at that point you can't really control it any other way than by stopping contacts, and stopping contacts in environments in which transmission is most likely to take place. And then what test and trace does above that and isolate is to try and remove from circulation as far as you can those people who are infectious. And as new testing methods come on train, that may be more possible more widely, but at the moment it's very difficult to remove everybody who's infectious from a situation where you've got high levels, which is why it's so important to get them down.
And why it's so important to self-isolate if you get a positive test, because if that doesn't happen, then obviously a lot of the force of test and trace is lost. Let's go to Richard Partington of The Guardian.
Thank you very much. Question for you, Prime Minister, and the Chancellor. I wanted to ask why the government was prepared to go to the wall earlier this week over £5 million with Andy Burnham, when you were preparing to announce billions of pounds of more support today through this expansion in the job support scheme. The Chancellor and the Community Secretary were pictured meeting business leaders in London this morning. Does this mean that London is of a higher priority than the north of England for the government? And then a second, if I may, why wait so long to announce these major reversals in policy when business leaders will have been making decisions about what to do when the furlough scheme ends for several months now? Does this not have a detrimental effect on employment, and should the government not have acted quicker?
I mean, sorry, Richard. I think you directed the question at both of us, but I'll quickly say my bit. Look, this was the negotiations between regional leaders, between metro mayors, was all about fairness. That's what that discussion was about. It was about making sure that everybody got the same package. What we're trying to do now is address a national issue, which is that obviously since the virus started to come up again, there's been much more concern, particularly amongst the business community, about people's ability to protect jobs and livelihoods because of the effects of the virus. And as the campaign adjusts, the fight against the virus changes, and obviously we change our response. That's only logical. But Rishi.
Yes, I echo that, Prime Minister. I think when we designed the job support scheme together with businesses that you mentioned about and unions, it was done over the summer with a view to the economy being open and restrictions being lifted. Now, obviously, the last few weeks, that has not been as those businesses had expected. Those restrictions were coming back. They were having a cumulative effect on the ground, particularly in Tier 2 areas, particularly in hospitality, and that's been the cumulative weight of the changes and the impact more broadly on consumer confidence that we've seen. And that's why we've been in discussions to try and see what changes we could make that would do what we want to do, which is to try and protect jobs and employment at this difficult time. And with regard to the meeting this morning, you're right, I was meeting together with the Community Secretary with representatives from businesses, unions, and indeed, in particular, the hospitality sector. There were plenty of people on Zoom as well, indeed, from, I remember, from Merseyside and North Yorkshire, as well as other places around the country. So I wouldn't take anything from the fact that the meeting happened to be held in London. And you're right, that was held in a restaurant that was closed to the public at the time and was used as a meeting for us, for Franca Manca. And I think it's important that we highlight the particular impact that what's happening on the hospitality sector, and that's why we were there, to bring that issue to light. That's what we were discussing. How are these social restrictions having an impact on hospitality businesses like that across the country? And how can we adapt and evolve our support to try and help those businesses protect as many jobs as people? And there are 2 million people who work in that sector. I've said repeatedly that those people typically are younger, women, ethnic minorities, on lower pay, and it is a matter of social justice that we do what we can to try and protect as many of those jobs as possible.
Thanks very much. Let's go lastly to Jane Kirby of the Press Association. Jane, you need to unmute Jane. Here we go.
Sorry.
Right.
Good afternoon. So Patrick, just picking up on what you were saying about vaccines, if we get a decent level of rollout by next spring, how soon after that can people expect to stop having to social distance and wear masks? Or do you think that those measures are going to be in place for much of the rest of 2021? And Prime Minister, if circuit breakers in Wales and Northern Ireland are shown to be more effective than three-tier restrictions, which some of your own advisors have said are useless, will you change your mind?
Patrick, do you want to go first on vaccines?
Well, I'm not going to speculate on how effective the vaccines are going to be. We will see the readout from the clinical trials over the next months. We'll see some, I hope, within the next couple of months. We should start seeing outcomes. Once we know how effective the vaccines are, then and how applicable they are to different groups, then you can start working out how to use them best. But you can't do that until you've seen the results of safety and efficacy. And when you see that, you can then start to judge what impact that's going to have. But clearly, the aim of vaccination is to try to take most of the load of the infection spread onto the vaccine in order to be able to release other measures. And that's got to be an aim that we would all wish for. And that's why so many companies around the world are working on vaccines and why there's been such remarkable progress. And it is remarkable. If you look at history up till now, vaccines have never been made in anything like this time frame. It's been at least 5 years, and so to be where we are now is remarkable.
Thanks very much. Well, I mean, I really hope that we do make progress with vaccines, and I wonderful that Patrick is so optimistic, if I can put it that way, about them. But we can't, Jane, in my view, rely on that. We've got to keep going. It may happen. We're working flat out to ensure that it does, but we can't just count on that. And that's why we have to do all the other things that we're doing. And you asked the same question everybody really is asking: should we just go back into another national lockdown and then possibly have another one after that, and another one after that? And I think that really would be economically, socially, psychologically really very damaging and difficult for the country. We all remember what it was like in March and April. There were lots of costs, particularly costs to kids who were kept out of school. There's a big social injustice. There's damage to people's mental health. It's to say nothing of the economic consequences of that kind of lockdown. So that's not why we're going for that approach. We do think that the local measures are right, and I repeat my gratitude to local leadership across the country, people who are helping to get the R down, get the virus down in their neighbourhoods, in their amongst their electorates, and we've seen plenty of great local leadership, and that's what we're going to continue with. We're going to continue to work with people across the country, but it depends on all of us. It's down to all of us really to follow the guidance. Hands, face, space. We haven't said that yet in this press conference. Hands, face, space. Do the essential stuff. that you know makes sense. Take a test if you have symptoms, self-isolate if you're contacted by NHS, test and trace. That's the way we can do it together. We can get the R down, keep kids in school, keep our schools open, and keep our economy moving and bounce back more strongly. And the package that we've outlined today is about doing just that, keeping our economy moving, keeping jobs, supporting jobs and livelihoods throughout the pandemic. Thank you all very much. Thank you.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.